A lot of Montrealers who relied on gyms suddenly found themselves with very few options for staying in shape. As challenging as that may have become, it is essential for your bodies and your minds that we Montrealers keep moving. I'm Richard Dagenais, and this is City Life. Joining me now to talk about how important it is to keep physically active during this pandemic is Dr. Ross Andersen. He is a professor of kinesiology and physical education at McGill University. He is also head of McGill's Health and Fitness Promotion Laboratory. Dr. Andersen, thank you so much for being here. And let me start by asking you, are you worried, or does it worry you that so many Montrealers are not getting enough physical activity during this pandemic?
Well, certainly we know that the being sedentary or inactive or not meeting physical activity guidelines is a significant risk factor. So it absolutely worries me, and it's something that I think Montrealers should be concerned about as well.
Significant risk factor in what, several different diseases?
Certainly, we know that sedentary people are at greater risk for all kinds of cardiovascular diseases, certain types of cancer, and just overall mental health as well. One of the people in your lead-in was talking about the importance of mental well-being as well, and we know that physical activity is important for the mind as well as the body.
So a body that is physically active, it actually helps the mind.
Absolutely. We know the research literature suggests that individuals who are physically active are less likely to be depressed, they're less anxious, their quality of life improves, and generally they just feel more energetic and have a greater sense of well-being.
Who is most at risk, or to some degree are we all equally at risk by being physically inactive for such a long time?
Oh, that's a good question. I think the people who are most at risk are seniors, especially sedentary seniors who, may have gotten out of their apartments or their living quarters and walked the halls. I know my mother lives in a seniors residence in Pointe Claire, and she's afraid to come out of her apartment right now. So I think older adults and people with chronic diseases who used to perhaps acquire or accumulate some physical activity with their day-to-day activities being shut in, it puts them at greater risk.
Are you concerned for the healthcare system, that so many people are physically inactive and so many people are potentially at risk of getting different diseases and complications as a result of the physical inactivity?
Well, that's a good question. I'm not really concerned for the healthcare system, at least in the short term. Certainly, we know that the long-term health effects of physical inactivity are tremendous. But right now, the healthcare system is overloaded with COVID patients, and I don't think that physical inactivity is really filling the hospitals up right now. There's good evidence that people are neglecting self-care during the pandemic, and not doing things like going for regular physical exams and planning regular physical activity into their week. So that certainly is a concern.
Dr. Andersen, from your point of view, is keeping gyms closed the right decision, or is it possible that the risks of inactivity outweigh the risks posed by COVID?
Well, this virus is transmitted in the air. And certainly, when people are huffing and puffing and breathing heavily, I think there's no doubt that it would put people at greater risk. So I understand the fact that gyms are closed right now, and I understand the frustration that many people have by not being able to get into the gym. Certainly, as we're rolling out vaccines and people are, hopefully we're going to be flattening the curve or reducing the numbers, and we can safely open up. But for the meantime, I think I would encourage Montrealers to look for other avenues and other ways to remain and to to remain physically active and perhaps increase their levels of physical activity.
Do you have any magic words to motivate Montrealers who are finding it so hard to motivate themselves in their living rooms or, their basement or?
Yeah, I mean, it's really, there's many types of exercisers and people who get physical activity. And, we know that some people really enjoy the social connections of group exercise, say at the local gym or the local YMCA. They enjoy, meeting up with friends and exercising, and that is going to be much harder during these times. But, there are lots of online resources, and I think it's important for people to look for opportunities to get outside during the pandemic as well, and do the walks, do things. Sports like cross-country skiing are a phenomenal way to accumulate physical activity and to remain physically active. So, I think it's a short-term thing. We know that during the winter months, Montrealers are less active than they are during the summer months. And with the pandemic, it just makes it even harder for people to get out. A lot of people are frightened to go out when it's slippery and they don't want to fall. Mm-hmm. I don't have a magic answer, but certainly being creative and looking for opportunities to be less sedentary is critically important.
The World Health Organization recommends 150 minutes of moderate intensity activity each week for an adult. Would that also be your recommendation?
I think that makes a lot of sense. 150 minutes of moderate intensity exercise or physical activity, I think it's important for us to understand what that means. And when we're talking about moderate intensity activity, we're talking about an intensity like walking as if you were late for an appointment.
Okay. Not
walking like you were strolling in the mall. And if we, some individuals like to do more moderate activity, like a walk, for example. And I think 150 minutes is a good target, at least to shoot for, at least 150 minutes a week. And that means that we should be doing that, being physically active on most days of the week. Now, it's possible to reduce the time that the World Health Organization recommends by increasing the intensity of exercise. So if we're getting more vigorous exercise, getting our heart rates up and elevated to the point where the breathing would be a little labored, we might be sweating and working more strenuously, it may be possible to reduce that to 3 30-minute workouts a week of more vigorous activity. So for people who like to train or to exercise at a higher intensity, they don't need to be doing 150 minutes of that activity to meet the guidelines.
Mm-hmm. For someone who maybe is thinking, okay, I don't know how I'm supposed to keep track of 150 minutes, is there a way for you to sort of break down the guidelines so that you can say, well, every hour it means this, or every day it means this?
Right. There's very good and relatively inexpensive smartwatches available these days. Things like Fitbits, the Apple Watches, the Garmin watches can keep track of the number of steps that you get and the number of minutes. They sort of take into account your heart rate and the number of steps or the types of activities you're doing, and they can keep track of that very well. But just planning your week out is critically important as well. Today, with Zoom and Skype and things like that, a lot of us just move from meeting to meeting. And a lot of people who are working from home are so heavily scheduled today that they just don't get a break. Mm-hmm. I might end one Zoom meeting and pop right into another right away. I think it's important to plan for breaks between meetings and to also schedule in our physical activity into the week. Otherwise, a lot of people say that they're busier than ever these days. Mm-hmm. So So I encourage people to plan and to carve out time in their weekly schedule when they're planning their week, and treat their appointment with their physical activity like it is an appointment, then something that should be cherished and held on to.
Dr. Andersen, for people who are feeling anxious, stressed, depressed about not being able to see anybody, about being cooped up, confined, is it fair to say that some physical activity or regular physical activity might help them psychologically? Or is that overselling the power of?
No, I don't think it's overselling. If you were to talk to mental health professionals, what would be the first course of treatment that they would suggest for patients who are feeling mildly depressed? The first thing that they would advise them to do would be to get up and get dressed and put their running shoes on and maybe go out for a walk or begin to adopt a more active lifestyle. There's a very famous physician who used to write for the Physician in Sports Medicine, Dr. George Sheehan, and he once said that not all my workouts have been good ones, but I've never finished a workout feeling worse than when I started. So I mean, the evidence is quite clear that people do feel, less stress. They feel less anxious after they exercise. They feel like they're more energized. One of the fastest benefits that we see to when sedentary people adopt a more active lifestyle is they just report feeling more energized, that they have more energy. So I would say that it's not overselling, and if people are feeling cooped up, to wake up in the morning, put their I always try to encourage my patients to lay their exercise clothing out the night before and put their running shoes at the end of the bed and get up and get dressed and try to work their get their workouts first thing in the morning so that the day doesn't get away from them.
We're out of time, Dr. Andersen, but I want to ask you very quickly, if you were to plant one thing in the minds of Montrealers who are having a hard time now, what would it be?
Well, I think to really look for opportunities to include physical activity into their lives, especially during these difficult times. It's an important thing. It's self-care, and as I mentioned before, I think most people feel better when they're exercising. So I would encourage people to try to look for safe and effective ways, and to look and seek for or seek activities that they like to do.
Dr. Ross Andersen, thank you so much.